joint gets stuck or jammed and stops moving for some reason, it forgets to lubricate. And lubrication is very important to a joint because the joint surfaces are coated in a very thin, hard, fibrous tissue called cartilage. I don't know, are you a hunter?
No, not really.
Have you ever skinned an animal and pulled the joint apart and looked at the surfaces of
yeah.
the joint? Those surfaces are a bright, pearly white color. And that pearly white color is the cartilage tissue on the surfaces of the joint. Now, cartilage tissue is so thin and so hard and so fibrous and so tightly packed together that it doesn't have any room for veins and arteries to run through it. And so the cartilage tissue relies on that fluid from the lubrication to keep it healthy. It absorbs oxygen and nutrition through the cell walls from that lubrication. So if a joint stops moving for some reason and is jammed or stuck and isn't moving like it should be, then it starts to dry out and get sticky. And as it dries out, it stops feeding the cartilage tissue, which then the cells of the cartilage tissue start to die, and when they die, they leave a hole which the bone grows up through. Then when the bone grows up through, then you have what you call osteoarthritis, because it's a bone spur poking up through the cartilage tissue, rubbing against the other side. So then you have these spurs grinding back and forth, and as the joint moves, it tears up the rest of the cartilage. Next thing you know, you're what they call bone on bone.
Yeah.
And then you end up with knee replacements or hip replacements or stuff like that. So the whole idea behind a chiropractic adjustment is to find those joints that aren't moving like they should be and force them into motion.
Okay.
It's not my purpose or my practice to go through and make every joint move.
Yeah.
Because most of them are already moving.
Yeah.
So we go through and we feel them, and the ones that aren't moving, we move them.
Sweet.
And so the concept of if you pop it too often, you know, there is that possibility if you get into one of those habitual knuckle poppers, then
that's what I always tell my kids when they're popping their knuckles and look like that. I don't really do it to bug them, but
yeah. Well, the concept of actually causing arthritis by popping the joint is not going to happen unless you overdo it to the point where you damage the ligaments.
Yeah.
And once you damage the ligaments to where they're so stretched out to where they don't hold properly, then you can damage the joint and cause arthritis. But generally speaking, arthritis comes from a lack of movement rather than too much movement.
Makes sense.
So we keep the joint moving, keep it lubricated, and keep the nutrition going, keep it healthy, then you don't have any problems.
Yeah, I know my buddy's